back to school here. In fact, some parents have already started to do this, while others, it's just around the corner. But before those kids go back to school, they need their shots here. And that's why we have Dr. Duane Wooten here. He's from the Rainbow Pediatrics. Let's talk first about the importance of those special shots. All the kids hate and they cry, but it's needed.
It's really important. You know, most kids are in significant classroom sizes where they're exposed to all kinds of diseases. And what we need to do as pediatricians and as medical professionals is make sure that everybody's safe. And so it's important for them to get those vaccines to prevent those diseases. They're very common, much more common than people think they are.
Well, let's talk again about the immunization shots and autism. And the link, if there is a link.
Well, there's no link. You know, when it first came out years ago, it was published in a British journal called Lancet, a very notable publication, but unfortunately they didn't do their due diligence. And they allowed a physician to print something that he had very little actual data to go to print with. And so it created a furor around the world. There's a link with autism and the shot MMR, measles, mumps, and rubella. We pediatricians were yelling, it's not true, but no one was listening to us. And it's funny, we're supposed to be the medical professionals in this area, but no one was listening. They were listening to the internet, they were listening to all these vignettes. And what it came up to be is that the data was pretty much fabricated. The person who printed it, it was rebuked. It was rebuked by every society of medicine in the world. And I heard that he was actually going to be indicted possibly for this because it created a firestorm where people really believed that there was a link with autism and that one shot. And there's no data that supports that whatsoever.
No evidence.
No evidence at all.
Okay.
And also the thing to understand about that, since we're on autism, is that everybody's saying that there's an increase of autism in the world and in America over the last 10 years. But I think it's more identification of the symptomatology of autism than an increase. And that's really, really...
You think more kids are just being diagnosed?
Diagnosed, absolutely. Autism and autism spectrum disorders is more of a diagnosis that allows a cascade of other events to occur, such as some help, some medical care via social services and behavioral services, which is important to have that diagnosis. So understand, I don't think it's more autism, it's just more identification. Of autism.
Back to the shots here. A lot of kids are going to be going back to school. Some already have. How late can you get those shots? Do you have to, you know what I mean? Do you have to wait a few days before you actually start school? Well, can you get them, say, that morning, and then your kid can be in school?
Absolutely, as long as you're up to date on your series of shots, because you have to remember the initial core shots are given at 2 months, 4 months, 6 months. So they've had those already. You probably know.
I'm going through that right
now. But once they get to that school age, they're getting boosters for the most part. So as long as they've had their initial series, they're fine.
Okay.
As long as they get them.
And very important.
Absolutely important.
And the big concern is also not just your kids, but the other kids that are in that classroom. Again, you talked about class size, and yeah, they're getting bigger and bigger.
They're getting bigger and bigger. There are more diseases out there that we can prevent, but there are some diseases, unfortunately, we can't truly prevent. When we have the ability to prevent disease, we need to do it. And the shots, vaccinations are so important. I was saying earlier, back in the late 80s, I used to see a disease called Haemophilus influenza type B, meningitis. I say it once to twice, maybe a month in my practice alone. Since that vaccine's been globally given since the early 90s, I haven't had one case of Haemophilus influenza type B meningitis in my practice.
Dr. Wooten, Rainbow Pediatrics.